The purpose of this video is to show the importance of understanding the catheter length versus depth of vessel. And what this means is when you're applying the ultrasound probe to a patient's upper arm, lower arm, wherever, as you apply pressure, what you do is you make the ultrasound probe move closer to the vessel itself by downward force. This downward force creates the illusion that the vessel is actually closer to the surface of the skin than it would be if you were to release the pressure. So what's happening here is that the vessel depth is not true to what you're seeing when you apply the ultrasound with downward pressure. In this clip, we're examining the brachial artery, which is underneath the bicep. As I apply pressure to the arm, you could see that the artery moves closer, and as I release it, it moves further away. As I release it, I'm showing you what the true depth is, which is closer to almost 2 centimeters down. Again, as I release the pressure off the skin and move the probe almost to the point where it's coming off the skin, which is where we lose the sonographic window, that's showing what the true depth is. And this is what you need to consider when you're choosing what type of catheter you're going to place in an arm, especially upper arm. Here we have one of several type of long catheter IVs. This is a 20 gauge, 1.88 inch or 5 centimeter long catheter. There's many different kinds, 2 inches, 2.25, and 1.75. All the lengths I'd recommend if you're going to be doing any work with an ultrasound. Of course, you can use shorter catheters, but in most cases, you're going to want to use longer ones, and I'll show you why here in a second. So here we have a situation where we really wouldn't even want to be using a ultrasound-guided IV. This is your typical standard 1.75 to 2 inch. You could maybe get away if you're a good inserter with the 2.25, but inserting into a vessel that's 2.5 centimeters deep, you're only going to be getting a tiny bit of catheter in there, really not enough to last any more than a couple hours. At 2.5 centimeters deep, or even 2 centimeters deep, you're only getting about 20% of the catheter in. Right here, we can see we got about 1 centimeter of catheter inside the actual vessel. And here we have the brachial vein surrounding, obviously, the brachial artery. The vein to the right is, as you release pressure, just about 1 centimeter-ish. Not terribly deep. This one's a lot more obtainable with your 1.75 to 1.88, but you still have to have a good trajectory to get that into the vessel and make sure you have a successful IV that'll last more than a few hours. And here we have the needle tip trajectory as we apply the catheter to see how much we get inside the actual lumen of the vessel. We see we're actually doing pretty good here. We get about 2.5 centimeters or 50% of the catheter in there. 60% is desirable according to a lot of the research out there, but 50% is still pretty good, especially in a pinch. Finally, this is the most desirable vessel you could get, one that when you release pressure, it's really not sinking very deep or getting to about, it looks like a couple millimeters in depth. Not bad at all of change from when you apply the probe to when you release the pressure. So right here, putting your 1.88 or 1.75 to or 2.25 is going to be okay. Even if it's upper arm, which is it depends on who you talk to, but sometimes it's again better to try to stick with the lower arm and stick with the midline or pick line for the upper arm when indicated. But all hospitals are different. Everyone's got their own needs. So, hopefully understanding what happens when you apply pressure with the probe in relation to true vessel depth and catheter selection. Hopefully this video will help you with that, because the last thing any of us want is displaced IVs, infiltration, and patients just being uncomfortable. We all want our lines to last, so do what you want with this information. Hopefully it's helpful. Thanks for watching.